You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, what you need to know about dental implants. With us, we have an expert on the topic, Dr. John Willardsen. Dr. Willardsen, welcome to the program.
Thanks, Randy. It's been a while.
Always a pleasure. We've had you on the show before.
Yes, yeah.
About 8 years ago.
Yeah.
And since then, back then, that's all you did was dental implants.
Yeah.
Today, same thing.
Same thing. I've built 3 dental practices, implant dentistry practices, and have enjoyed it from the beginning.
You love this. You love dental implants. We've talked before.
I do love dental implants. I of course finished dental school in 1997,
Wow,
a long time
you
ago.
You look young, all right.
So, and then I did a residency program, which I finished in 2001, which was also at Loma Linda University, that was specifically implant surgery and implant prosthodontics.
Now, you're an instructor at Loma Linda, is that right? You teach other dentists from all over the country.
That's right.
How to do it.
Yeah, I teach the residents implant surgery. I teach other dentists implant surgery and prosthodontics, which prosthodontics is basically the fabrication of the teeth, the bite, aesthetics, making sure that that it functions well and is going to last them the rest of their life, basically. So,
and you've done thousands of cases. I mean, is that right?
Yes.
I mean, you probably do more than a month than most guys do in a year. I mean, you're a very busy guy.
Yeah, you know, implant dentistry is growing by leaps and bounds. There's a lot of new courses coming online, or I get mailers every day of a new dental implant course.
Is there really that much to it, though? Seems pretty straightforward. You put the dental implants in, you put a tooth on top. I say that respectfully, but there's that much to it?
Yeah, no, there's a lot to it, and a lot more than just a weekend course. There's no way you could possibly, well, take for example, somebody who say they're wearing dentures,
yes.
Okay, and they're tired of their dentures. Yeah. They're tired of wearing the denture adhesive, the glue, that they have to use to hold it down, that maybe will last an hour or something. And so to take that person and to use dental implants, which a dental implant is a titanium screw that is used as an anchor to lock down the prosthesis or the teeth. And so the screw is inserted into the jawbone, and then the teeth are fabricated or made on top of that. So a couple of things you've got to take into consideration. One, you're dealing with a surgical specialty. You have to understand surgery. You have to understand anatomy. You've got to understand healing, health history, medical history, and then you have to understand prosthetics, which is their bite, the aesthetics, the way it works and functions. So,
who's the typical patient you get for dental implants that you see?
A typical patient would be anybody who's missing one tooth, 2 teeth, all of their teeth. Anyone who has problems with a tooth, possibly say they have had a root canal multiple times and now maybe they need another one and the tooth has to go or something. That's a pretty typical scenario, someone who's going to lose a tooth or are missing teeth or are missing all of their teeth. Those are typical implant patients and candidates for dental implants.
You say pain is not something that they really complain about.
No.
Because it seems like a very painful procedure.
Yeah, I mean, you would think that any type of surgical procedure, you're going to have some, discomfort or pain afterwards. But, 80% of our cases are done under general anesthesia. We put them to sleep.
Really? Okay.
And so they're, obviously they know nothing of what's going on during the procedure. And then proper and good surgical technique minimizes pain, believe it or not.
So when they go home and they could have what, ibuprofen? Or?
Yeah, and of course using medication to help monitor and to help them get through the couple of days of discomfort. So really, pain isn't something that I have to deal with much, other than just, making sure the patient is they're taking their medication, and the surgical technique that I use is pain-free, and we use a technique that is less invasive. So the less invasive you go, the less pain you're going to have.
Is that what's changed? I mean, when I met you 8 years ago, we talked about dental implants. I mean, what's changed in those years? I mean, is it less downtime?
Yeah, we can finish cases much quicker now. Surgical technique, having imaging, for example, we know exactly how much bone we've got, the length and diameter of implant to use. Of course, I do the surgery on my computer before I get into the patient's mouth.
Right? Okay.
And so, it streamlines the process. For example, when I'm drilling the hole for the implant, right away I know the density of bone. I know how soon I can put pressure or load that implant.
How old can you be, by the way, to get dental implants?
Well, I have patients who are in their 80s, and
really?
they're going.
Why would an
80-year-old
though
treatment?
Well,
imagine, Randy, if you were, whatever age, whether, 75, 80 years old, if dentures were something that you struggled with on a daily basis. I mean, it's hard for you and I to imagine, because we have our teeth, but imagine every meal, even just interacting with people, worrying about your teeth falling out.
Do they tell you that? I mean, when they're on the consult? Do they say?
Oh yeah,
absolutely.
They'll say that it's a constant burden. It's something that they never, not worry about. They, of course, have accustomed themselves to that, but it's always on their mind. And I tell my patients, if I could let them test drive this and put the implants in for a day.
Or for the weekend.
They couldn't
go back?
That they absolutely would never go back. It's that much of an improvement. It's a night and day difference.
You say you're changing people's lives.
And that is
just by giving their teeth back. I mean, raising their self-esteem.
Absolutely.
Elaborate on that.
Yeah, I do. I change people's lives every day. In fact, the other day I had a case, and this, to me, it was a simple case. It was basically replacing their front teeth.
Okay.
And this patient had been without front teeth for many, many years. We had placed the implants and we were finishing. So I had we had put the final bridge in, and the patient started sobbing.
Really? Crying?
And I wasn't sure if they didn't like it or what. I was a little taken back, but come to find out, she just could not believe that she had her teeth back. After all of these years that she had gone without teeth. Imagine, not having your front teeth and getting those back in just a matter of, in just a few short months.
So these are extreme makeovers. I mean, what you see are huge makeovers.
In fact, it's a makeover that affects. It's such an extreme makeover that it affects their digestive system, it affects their psychological health, it affects their ability to eat, it affects every aspect of their life that you and I take for granted because we don't have issues with our teeth. This is a case where...
You brought some photos. What are we looking at there?
Here's a patient who had seen 22 other dentists to try to solve this major problem that she was having. And
so what was going on?
Well, she was losing her teeth. Periodontal disease had set in.
So she was told her teeth have to go?
She was told by, half of them said they could save them, the other half said they all needed to go.
All right.
So there was kind of a debate. And once she made it into my office, basically she walked out with a plan. And that plan showed her from A to Z. Basically, here's where we're going to start, and this is where we're going to finish.
So with her I mean, you saw it, you say, hey, your teeth have to go.
When I saw her case, there was really no debate as to whether or not we could save any teeth. They all had to go, all of them. And so Then it's a matter of, once we've made that decision that the teeth have to go, how are we going to restore the case? What are we going to do to give her teeth that are fixed and are permanent so that this problem is eliminated, that it's no longer an issue for her?